Hello, I'm Andrea Cooley with Des Moines Mom, and today I'm here with Jessie Becker with UnityPoint Clinics. And I'm excited just to learn from Jessie about how UnityPoint Clinics are really offering safe care in a variety of different ways for families as we continue to kind of live in this season of COVID and a pandemic. So thank you, Jessie.
Hello, good morning.
The first question, are your clinics open, and what clinics are open? What are their hours?
Yes, my particular clinic, I am at the UnityPoint Express Clinic in West Des Moines. There is another location that opened up in Waukee as well. We are open 7 days a week, 365 days a year from 8 in the morning till 8 at night. So it doesn't matter if it's a holiday or not, we are always open. So we're open to seeing anybody that comes through the door. So cuts, scrapes, possibly broken bones, illnesses, runny nose, ear infections, anything we can see. Even if they are having possibly COVID symptoms and they're worried about that, they would just call ahead, let us know they're coming, and then we go from there, but we will still see those patients as well.
That's great. So call ahead to make, whether it's a regular appointment or if you suspect that you may have COVID, and how would those appointments look different, or what would someone expect when they come to the clinic?
So you don't always have to call ahead for all appointments. It's still a walk-in, so you can come any time of the day. When you come into the clinic, it's basically going to be the same as we've always had it. Is you come in, you're greeted at the door, and you're taken directly to the room where all of our registration and rooming process is all done right in the room. So you're not going to be waiting in the lobby. In the case that our rooms are full at that time, you'll be greeted at the door and then asked to sit in your car and wait. And then we text you or come out and get you when it's your turn. So then you bring you right in and directly to a room. So again, you're not sitting around other possible patients, and that's our way of keeping you safe as well. When we are greeting you at the door, you'll see we'll have our masks on, as well as we do wear eye protection. So it's not alarming. We do that for all of our patients just for safety wise. Even if you're coming in for maybe a foot problem or an arm problem or a cut, we are still wearing our personal protective equipment through your visit as well. And then we usually have you wear a mask for safety too. Some patients have problems with that, so we kind of work with them once they're in the rooms.
Okay, that's great. I think, sometimes moms or families may be thinking, well, we're healthy, so we should, stay home and not be going to the doctor even for regular checkups. How would you answer that?
You should still be seeing your pediatrician, your primary care doc. Get those kids in for their well visits. If they need their up-to-date immunizations, they need to be getting those as well. Even if your child is sick or you're curious if they're sick or something's going on, that's what we're here for. And the pediatricians are still open as well. Some of it just may look a little different than what it had in the past, but all of our clinics are still open, and we're just taking extra precautions so that, people are avoiding cross-contamination. But we're here and we're open, and those are the things that are important. That care shouldn't be pushed off because of that. We need to be, getting the care we need, and don't want you to be afraid to come in and get that care. A lot of my patients that have showed up come in and they just waited because they weren't sure if they could come. Can I come? Can I not come? They're scared because, well, mine, I have a runny nose and an earache, but I'm not that bad. So, I didn't feel it's probably the most important thing you're going to see today. Well, that's not true. All of our patients are important. All of your symptoms are important. So just to put something off because you don't feel because you can't breathe, that's not important either. Ear infections need to be treated. Urinary tract infections need to be treated. Kids still get bug bites that get infected. Those need to be treated. Don't put them off, because you're scared. We want to make sure that that we're taking the extra precautions to keep you safe. bring your kid in, bring your complaints in. You know, we would rather treat them early on than letting you get sick and suffer.
Those are great tips. I know one of my kids, he just is prone to fevers. And so, you know, especially during this time, it's a little bit more stressful. All right, sorry about that. It can be, you know, he had a fever earlier this spring, and we did, you know, call the doctor. And you know, if someone calls and says that they have a fever or that they may be having some respiratory symptoms that they think may be COVID, would there be a different process for them coming in, or is it still?
They're just going to call ahead to our clinic and let you know, they let us know they're coming in. You know, we just make sure to mask and take our precautions. But for the most part, we're taking the same precautions for all of our patients. But letting us know sometimes it's helpful that you're coming in for that, especially if you have questions. But we're not going to turn you away. We're still going to see you. You know, some people are still getting sinus infections, but their symptoms can be somewhat similar to COVID, so they're nervous. I mean, we're not going to turn you away. You still might need treatment for that sinus infection. You know, and if we do find that you need treatment, you know, or a COVID test, we're going to try to get you scheduled and tested for that.
Great. That was my next question. If someone came in and thought, you know, you thought that they needed a COVID test, is that something that you would do in the office or that they would have to have scheduled?
At this point, we are not doing them in our office, but we are scheduling patients to get in and get tested within a day or two at a location still. So it's not a very long wait. Some of them I've even been able to get in same day. So it just depends on the day. But we are getting patients in and getting tested. We'd hopefully like to be able to do our own testing, but that's just really up in the air until it's further decided.
Great. I think that's just all really helpful information, especially as families start heading back to school. And I know it seems like once my kids go back to school, even in a normal year, they start to have sniffles and coughs and, you know, just things where they need to go to the doctor. So you said you are at the UnityPoint Express Clinic on Jordan Creek Parkway.
Yes.
But there's also one in Waukee, and then
yes.
Did you say there's also one that will be opening in Ankeny? Is that true?
Ankeny will have one as well, but not until 2021.
Okay, great. Well, I think the setup of your clinics is just so helpful for parents, that you're open 7 days a week, that your hours are extended from 8 a.m. to 8 p.m. It just makes it really convenient, even though it's never convenient for kids to be sick, but you guys are making it as painless as possible.
Yes, and their pediatrician's offices are still open. They're not closed. Mm-hmm. They just call ahead there, and if the pediatrician, you know, they just feel like maybe we can't get you in today, or you can't be seen, or they're worried about getting you seen in there for one reason or another. I mean, that's where we would come in, you know, or if you don't want to wait another day to get into the pediatrician again, the parents are worried, that's where we come in, because you don't have to, you know, have a specific appointment time. But those pediatricians, they still want to see everybody. They still want their kids getting their vaccines as normal. They get their well checks due. We need to be keeping up on that as well and not letting it get behind. And they are open. And I know that they're working hard to try and call patients and parents and say, we're open, let's get your kids scheduled, so they're not behind with their summer birthdays. Mm-hmm. And getting them in there. So
great. One last question I have. Are you offering from your clinic any virtual appointments, or you are there for people to come in person?
We are offering some virtual somewhat. Usually it just goes to a pool where there's a bunch of providers that can see you. So it wouldn't be maybe one of our providers specifically, but we are doing virtual visits. So you might just see another provider from another clinic. But yes, we are providing virtual visits. But our clinic is open to see everybody. So if someone's not comfortable, they can always do the virtual visit. But we're here and we're taking those safety precautions. So that way, sometimes you just feel better. I want to look in my ear. I want you to listen to my heart and take my blood pressure and temperature. And sometimes having that face-to-face talk in the same room is more comforting. So
Yes. Well, great. Thank you so much, Jessie. We appreciate all that you're doing, especially during these challenging times. And it's great to know, it's comforting to know that UnityPoint is just offering all of these different options, and that we can feel safe and protected for our families.
Yes, I agree. I'm very proud of our organization and keeping patients safe and provider updates on a daily basis. So we have worked very diligently to try and make sure that the community knows that we are here no matter what.
All right. Well, thank you so much. I hope you have a good rest of the day.
Thanks, you too. Bye-bye.
Goodbye.